I'm so impressed with the programs at the Native American Health Sciences that provide support and pathways for students who are entering into the health professions. The new clinical exam space at the Center for Native American Health was designed to bring Native American healthcare providers together with Native American students and non-Native students to learn to provide care and to respect Indigenous cultures. This center will set a new national standard of excellence for welcoming, educating, and supporting interprofessional students as they learn to provide better care and address issues of health equity.
So I just want to start out by sharing a quote by a tribal doctor from Alaska, Dr. Rita Blumenstein. She's a Yupik tribal healer, and she shares about true healing, and I really feel like it reflects in this space that we've created. And she shares, "We are free to be who we are, to create our own life out of our past and out of the present. We are our ancestors. When we heal ourselves, we also heal our ancestors, our grandmothers, our grandfathers, and our children. When we heal ourselves, we heal Mother Earth." And it's a profound saying that I believe echoes the wisdom of our ancestors, which are reflected in this healing place. That we recognize our first medicines and we honor them equally amongst all of the other medicines and ways of knowing. And we bring together the understanding that culture is medicine, that food is medicine, that our indigenous plants and the spirits of our ancestors are ways that we can promote healing. And it's a place where holism and integrative ideas are welcome. And it's one that honors the cultures of our Washington State tribes, our tribal nations, and beyond.
The space I'm standing in is a very beautiful place. It took a lot of hours, a lot of night times spending with fellow physicians, fellow professionals, really thinking it through to make a place that's warm for the patient and to help our physicians, nurses, and pharmacists be comfortable dealing with patients to really get to the story that each patient has to share. Because the real healing starts when the patient kind of opens their heart to really let you know what's going on. So we really wanted this place to be warm, comfortable, and releasing so the individual can, in a sense, I guess, get on with their lives and go from whatever ails them at that time.
So to future students and to my future classmates and colleagues, I really hope you get to experience this space for all that it is, so that you can help develop a new sort of patient empathy, and also that you are part of their community and they are part of your community, and that in embracing that, you can tap into a different connection with them than just the typical provider and patient relationship. And by making a different level of connection with your patient, it can ultimately help the long-term health of them, and honestly with your job satisfaction, because we know that burnout is a large problem in medicine. And so I think this space helps you view your patient differently than what we've usually been taught in medicine, and also helps you view your role differently than what we've usually been taught in medicine.
So with student pharmacists, when they first determine that they're going to be healthcare providers, I think there's this need, this want to heal people, and to heal people through medicine. I can figure out what's wrong with you, I'm going to give you this chemical preparation, and then you are going to be healed. And I think that is a way oversimplified view of who we are as people and what we truly need to be whole and to be healthy. And so I think Western medicine has looked for a number of years to standardize care. And as they've standardized care, to a certain extent, they've turned people into widgets and making these widgets fit into this big machine. And as humans, we are not standard-sized widgets, but rather we're individuals with backgrounds and histories and hopes and dreams and aspirations. And all of that should be considered within our medical care.
So Empire Health Foundation has there's as many reasons for supporting this project as there is need in our region. So some of the primary conversation, to my knowledge, was really just around the lack of doctors being able to serve in tribal communities. I come from the Colville tribes, where we have one doctor and one PA serving a 4-district reservation with a total tribal membership of 10,000 members and close to 5,000 that are living on reservation. So part of it too is really about the quality of care and really having just the future of medicine and of health services and the workforce be one that's deeply centered in understanding of the strength and the value of our Native cultures, as well as being able to offer and honor traditional ways of healing and approaching health and medicine.
What I said was hello, good day. Badger is my name in my language my dad taught me. And I'm Andy Joseph Jr. I am the chairman of the Colville Confederated Tribal Council. WSU School of Medicine, we're going to grow our own doctors, and that's something because a lot of our people want to come home. And hopefully we'll have jobs for them when they finish their schooling.
So the student growth is the opportunity to practice. And with everything that we do, we should practice like we truly play. It really just gives them the opportunity to succeed and fail in a very safe space where they get feedback and they can talk about that whole dynamic of not only how they felt, but what they could do going forward to change their practice, to make interactions with patients better, and ultimately patient-driven versus physician-driven, which ultimately will make the patient better.
So this place is really a place that a lot of elders and the ancestors of this land, the Spokane tribal nations, have created an opportunity for us to honor them. And this place is a place where we can learn together and honor the tribal nations and their wisdom that has gone before us, all of the leaders that have helped make this happen, the funding streams and the support that have made this place possible. So we thank all of those that have laid the groundwork for us to really create a paradigm shift where holistic ways of knowing, indigenous ways of knowing, culture as medicine are on par with all of our other Western medicines. And to me, I really feel like that is what the world needs right now. Is it needs connection, it needs hope, it needs holism. And this is going to be a place that creates that opportunity for understanding and also the practice of holism.